Call me the Nigerian Uncle Iroh if you want, but I love tea. I love tea so much. Ooh, but do we have some good tea to spill today? So very recently, Abdul Sayed, shout out, won the US Senate Democratic nomination in Michigan. And one of the major things on his platform is Medicare for all. So I want to talk about it, y'all. Just to be clear, I am not an economist. There's a bunch of different numbers, a bunch of different studies about whether we can do it or not. There are a lot of people arguing for it. There are a lot of people probably paid to argue against it. But the US has so much wealth that if we want to do it, I think the summary is that we can. But as someone who practices in the emergency department, I'm going to talk about whether we should do it or not. And the answer is we should. Here's the thing. A lot of other developed nations have decided we don't want our citizens to have to worry about healthcare. It's one thing that connects us all. It's one thing that we all deserve a good quality of it. We're like the only ones left. But more significantly, I've worked in a lot of different hospitals now. I've worked in public hospitals, I've worked in private hospitals, I've worked in academic hospitals, you name it. Ultimately, at some point, even in the public hospitals I've worked in, I saw a lot of people who just happened to lose their job, lost their health insurance, and show up there. And there's significant difference in terms of resources available for people who have good insurance, bad insurance, or no insurance at all. But also, kind of from a more practical perspective, one of the major stressors of all Americans is the rising cost of healthcare. It doesn't even matter whether you have good insurance or not. They're always gonna try and find a way to get you pay more for something. Because at the end of the day, these insurance companies are about making money, and healthcare is about making money in this country. I'm not saying all healthcare workers are trying to like scam you. I'm Nigerian, so I love a good scam. But I'm not saying that we're trying to scam you, but I'm saying that the system is built to make money. The system is not built with the mindset of taking care of people. But imagine what it would be like if people didn't have to stress about medical insurance, right? They can work their jobs, and even if they get fired and are laid off for a bit, they don't have to have this increased stress. The truth is that the system we have now sucks. Even though it's the most pricey in the world, it's not the best quality, and multiple studies have been done about that. Honestly, I think the reason why a lot of people are down or like the idea of Medicare for all, because at the baseline, it is just another way of saying that we all deserve the same thing. It's a kind of way of thinking about equality to a certain extent, because we are all human, we all will get sick, we all will die, we all will suffer different ailments. And the idea of having insurance that we all pay into and we all get to benefit from, I think is another way of just saying we're all equal. But thought about it another way, it's a good way to avoid future Luigi Mangionis, because people are still unhappy with their healthcare. People's claims are still being denied. What do y'all think?